BLA will be filed. What are we talking about?
Late this year, early next. I think it really depends upon whether Amgen wants to file just on PMO or on the indications for cancer. I think my personal view is that I think it would be an easier process if they were to go first with PMO rather than confuse the label by throwing in a cancer population at a different dose with a different risk-benefit profile. So maybe what they do is they file PMO and wait for the approval and immediately drop in the supplemental application after that.
That's right. They are developing also this Denosumab for other indications as treatment for bone damage and bone disease following cancer in terms of complication of cancer.
That's right.
What do you think about their clinical development strategy?
I think it's very clever, and I think it's something that is a burgeoning area within cancer now. There is the treatment of the side effects of either the treatment of the therapies that are used that tend to damage the bone, as well as damage that is caused by the disease itself. So in the case of Denosumab in cancer, it's breast and prostate cancer as the two lead indications, but there are also many other areas in which one could imagine Denosumab having an effective role, and that would be something like myeloma, where myeloma bone disease is notorious. And I think you could also see ultimately by protecting bone, better survival in cancer patients. Now those studies are a long way off, so as a sort of, you can't really call it palliative, but for lack of a better term, it's a palliative therapy to protect bone. But ultimately, I think it will turn out to be as important in the treatment of cancer to sort of take away the soil that the cancer can grow in, to have as a therapeutic, a direct therapeutic for cancer.
No, because you're absolutely right. A lot of patients don't die sometimes from their cancer immediately, but for bone fractures, and then they are, first of all, they are in bed all the time, so their mineralization is not good. And then when they went a little bit better, then they have a fracture, and then it causes
a bone fracture in a cancer patient is far worse than it is in a postmenopausal patient, and that's not a pretty picture either.
So do we have in the recent history on biotech a similar case of what we are seeing today with Denosumab?
I believe so. I mean, I think I use several precedents to try to highlight what I think is the market opportunity for Denosumab. And I would go back as far as 1998 to Enbrel in the rheumatoid arthritis market. I would look at Avastin, and I would also look at it. I would look at that paradigm. You asked me before what effect did I think Denosumab would have on Amgen's stock price. If one looks at what happened with Genentech relative to the Avastin data, it basically doubled the stock price within 2 years. I think that it's potentially a similar situation when it comes to DMAB's effect on Amgen's stock price. But Avastin really turned the cancer therapy market on its head and sort of rewrote the rules. And then most recently, I would look at Tysabri. I mean, it's unfortunate what happened with PML, and I don't think Tysabri will ever be the blockbuster that it appeared that it could be at one time. But the point there is that here's another crowded market. You had 3 interferons, you had Copaxone, you had some of the other more toxic therapies for MS, but you didn't really have something that affected the course of the disease in such a profound way that was also a relatively easy therapy for a patient to take. And here we have DMAB doing that. And I would again go back to the Enbrel example where you had all these sort of nasty old drugs and dissatisfaction amongst patients and physicians, a lot of switching, and all of a sudden, oh my goodness, here's a drug that's very easy for patients to take, has results that are unprecedented. May not totally be true about Denosumab because you pointed out Reclass had similar results, but the combination of the characteristics really makes it a truly dynamic drug that I think is going to invigorate the market. We had done some work on another company we follow a couple of years ago called Osteologics, which is developing strontium, and we had spent a lot of time talking to experts that treat osteoporosis about sort of the market dynamics. And you know, universally, they all said, you know, it's underdiagnosed, and even when it is diagnosed, it's undertreated. So we hope that and expect that denosumab will hopefully obsolete that.